Dusty was diagnosed with Duchenne muscular dystrophy at the tender age of 6 in the late 1990s. Back then, the world was a lot less connected than it is today. At that time, Duchenne research was underfunded, even though Duchenne is the most common fatal childhood genetic disorder that affects 1 in 3,500 boys worldwide. After getting up from being knocked down, we began our quest to save our son. We thought scientists would help us with treatments and cures, but we found that it is a broader collaboration that moves research forward. Duchenne is complex. It takes us all coming together: parents, Duchenne organizations, pharmaceutical companies, scientists, doctors, boys and young men with Duchenne, and the global community to really make a difference. In the beginning, we created the Dusty Brandon Fellowship in 2001, which contributed to groundbreaking research at the University of Western Australia into exon skipping that a company called Sarepta Therapeutics has commercialized. One drug that will help 15% of boys with Duchenne has been approved by the FDA, and other drugs using the same technology are being processed by the company.
What we're hoping is that this RNA antisense treatment will slow the progression of the disease down, let the boys make the missing product, and restore quality and function in their life.
We funded small animal work at the University of Pennsylvania for a novel drug called PTC-124, which is now called Translarna. It has been approved in Europe and was, at the time, the first ever Duchenne-specific drug, and hopefully soon to be approved by the FDA. As Dusty got older and his heart and lungs became more impacted by Duchenne, we realized that there is no Duchenne-specific treatment for the heart. Cardiac and pulmonary issues are the major reason why we lose our boys too young.
So heart disease is now emerging as the major cause of death in boys with Duchenne.
In 2011, I read an article in The Economist magazine called Repairing Broken Hearts. It talked about Dr. Eduardo Marban, the director of the Cedars-Sinai Heart Institute, who is using cardiac stem cells to treat adults with scarring from heart attacks.
We tried that hunch in patients, adults who had had a heart attack, and we found indeed that these cells could go into the zone of the heart attack and shrink the scar and grow new healthy heart muscle. So that finding was the one that spurred us on to think, gee, how might this help other kinds of heart disease? And ultimately that, with the help of Coalition Duchenne, took us to Duchenne cardiomyopathy, the heart failure that affects patients with Duchenne.
Coalition Duchenne was gracious to fund the mouse studies in Eduardo's lab, which had really wildly positive results. And that led to the early phase clinical trial, the HOPE Duchenne trial.
A clinical program for Duchenne based on the technology is now underway. We are excited to continue collaborating with leading researchers around the world. Coalition Duchenne's outreach initiative, Duchenne Without Borders, distributes breathing devices and information about treatments to boys with Duchenne in underserved areas in several countries. Coalition Duchenne is committed to holding international events that bring people together to raise funding and global awareness for Duchenne. Awareness is key. The world needs to know about Duchenne.
Since 2011, we have brought over 600 climbers from over 25 countries to climb Mt Kinabalu in Borneo, one of the highest mountains in Southeast Asia. This has inspired others to climb mountains for Coalition Duchenne in parts of Asia and Europe.
Today I'm flying for Dusty. Support Coalition Duchenne.
Coalition Duchenne worked in collaboration with Squirrel, a wingsuit manufacturer, to develop a bright red Coalition Duchenne wingsuit, which has been worn by wingsuit flyers around the world.
We were excited to release our award-winning feature documentary, Dusty's Trails Summit of Borneo. The film has been an incredible medium to raise global awareness about Duchenne, and now has secured international distribution. More and more people will learn about Duchenne through the film. People have said that the film has changed their lives. Dusty's attitude in the face of adversity, the way he does not even acknowledge adversity, has made people realize that they can overcome obstacles in their own lives. Our journey with Dusty and Coalition Duchenne's funding of research and its awareness efforts have led to change that will help all boys and young men with Duchenne worldwide.
My mission in life is to do things that are fun and that I enjoy, and also to have a positive outlook on life. One thing that I'm into is playing computer games on my computer. But it's not just any regular games I play. It's actually like A lot of them are very advanced simulation type of games. Like there's this one game where you have to build an entire engine for a car, and like I just had to watch all these videos how to do it and stuff like that.
I'm a very big basketball fan, very big football fan. You know, I love sports. My dad's a football coach. I grew up on the football field, so you know, those would be the fun things I do. Love to hang out with friends, very social. I love to get to know people. I like to get deep with people.
Probably my favorite hobby is painting. My favorite painting is the heart painting, because it has different colors, and it has a strong message of like how there's love in the world, and it could even represent the heart with Duchenne.
Coalition Duchenne is a call to action and a call to make a global difference.
We want to keep their hopes and dreams alive. Thank you for supporting us.